So a few thoughts for you this morning about periodontitis and periodontal disease. One of the discussions we frequently have with many of our patients is the difference between a basic cleaning and a prophylaxis basic cleaning and periodontitis and the periodontal maintenance visit. We had a patient this morning who got up and left the office pretty frustrated despite best efforts to have a conversation relative to why a periodontal maintenance visit was needed versus a basic cleaning. You know, a couple of things to mention here. Number one, we always try to cater our treatments to the needs at hand. We're not just going to recommend a basic cleaning because that's what you've had every day or every 6 months for your entire life from another dentist or from our office, assuming you were healthy at the time. And then number two, how do we have the conversation about what your benefits will cover versus what treatment you need? So, you know, we oftentimes, and I had this experience when I moved into a new practice early on in my career where the previous dentist had not really been talking about periodontitis to his patients, not even using a periodontal probe for that matter. So have patients that come in and we're telling them now you need, instead of a basic cleaning, you need this 3-step gum treatment, which essentially is going to cost you a healthy amount of money. So why do I need this, the patient asks, as opposed to the basic cleaning that's been done multiple times over the course of my life? So it helps to help them understand what's going on and the consequences of what's going on. You know, I'll tell the patient, you have an active gum infection. This is more prevalent than you know. Many people in the United States have it. It's painless. Most people that have it don't know they have it until someone like me pokes your gums 168 times to tell you that you have it. It also is the leading cause of tooth loss if left untreated, according to the CDC and the ADA, and it ultimately increases your risk of heart attack, stroke, Alzheimer's, dementia, and now we know COVID-19 mortality. Because it's a chronic inflammatory disease, it causes all sorts of issues that directly connect and correlate to other diseases in the body. So helping them understand that this is not just swollen gums, this is not just recession, this is not just gingivitis, this is an active, ongoing bacterial infection. And the unique thing about the gum disease, it's not actually inside the body, it's in between the body. So it's in between the tooth and the gums, it's in that space right in there. It's not actually inside the body. So your immune system can see it or can see the inflammation that's caused on the surface of the gum tissue where it's touching, but it can't get to it. So what happens is the body throws all this inflammation at it, which causes advanced bone loss over time, and that increases all sorts of risks because of the inflammation and the bacteria that can eventually get into your gums. So that's the gum disease. You know, helping the patient understand, you know, showing them on an x-ray, showing them on these, you know, charts that you see behind me over here, helping them to understand here's healthy gums, here's unhealthy gums, and then demonstrating in the mouth with a periodontal probe, here's a measurement, here's a healthy area, here's a deep area. Do you see the pocket depth difference and what this means? Kind of explaining to them what that is. So once we've helped them understand what it is, then we can talk about their coverage. And you know, I'll be very cautious and tell you this, I'm not an insurance expert in any way, shape, or form. I really, to be honest, don't know much about it. But one image, one metaphor that I like to use is, you know, your car insurance is an indemnity program. It basically pays for repairs in the event of some sort of an issue. It's not designed to cover everything. It's not designed to cover maintenance. Now, some insurance plans, not car insurance, but some dental insurance plans will cover some maintenance procedures. But your auto insurance generally does not cover any maintenance procedures. That's on us. So patients will ask, well, nothing hurts. Can I just wait until I have problems? Well, the same would apply to your car. Well, there's no issues. Can I just wait until I have an issue to change the oil? I mean, it's kind of a no-brainer, but that's a very apt metaphor. You certainly can wait, but as you wait, you increase all these risks. With a car, you know, you don't change the oil, eventually you'll end up needing a new engine, which is thousands of dollars and lots of frustration and all sorts of issues. Now with the gums, if you don't do the maintenance for patients that have periodontitis, eventually as we get to the later stages of gum disease, you dramatically increase the risk of losing teeth. And in the severe stages, you know, stage 4 and beyond, you'll lose on average 1 tooth per every 4 years to the gum disease. So the metaphor holds true. If we ignore things until later on in the stages, like changing your car oil until you start to hear knocking or other problems, then eventually the treatment, the solution will be that much more expensive, and usually it's a catastrophe that happens on the highway, like you're eating a sandwich and your tooth comes out or you break something. So talking about the insurance is a helpful way of helping them understand as it pertains to auto insurance, which I think is an appropriate metaphor. There are lots of metaphors out there. That's one that a lot of people tend to understand. One other thing that I would mention is a lot of people will ask, well, why do I pay for this insurance? The insurance only covers this, so that's what I want. And certainly you can have that conversation with them about, well, your insurance doesn't necessarily cover this. This is something you need anyway. They oftentimes wonder why they need it if their insurance doesn't cover it. And so at that point, if we get to a discussion like this, I like to tell them, well, just because your insurance doesn't cover it doesn't mean that it's not a necessary treatment. And again, we can refer back to the automobile and oil changes, et cetera. But most patients don't understand that the insurance that they have, the dental insurance, is not something that the fees are not negotiated with us. Now, I agree to sign on to an insurance plan. We don't necessarily have the ability to negotiate any insurance fees that we accept, though. We're obligated, we're locked down to contracts that we have to follow. So I have very, very little wiggle room, if any, to make any adjustments to fees. Those fees that are part of their insurance plan, the patient's insurance plan, your insurance plan, are based on a discussion, a negotiation between the insurance company, whether it's Aetna or Coventry or Blue Cross or Delta or whatever the insurance is, the negotiation between the insurance company and the employer or whatever group is providing the insurance. It's not between the dentist and the insurance company or the patient. We're a third party. We accept the insurance or we don't. And if we accept the insurance, we have to honor the agreement. That agreement means I will accept the fee that I can charge for the procedures within any given insurance, and I will also charge the patient the agreed fee that I should be charging them. So those fees, the costs for periodontal maintenance, for a basic cleaning, for a crown, for a root canal, for a dental implant, those fees are given to me by the insurance company. They're negotiated by the employer that provides the insurance and the insurance company themselves, not the dentist or the dental office. So that all being said, it's critical that we help our patients understand the issue that they have has consequences. Periodontitis has consequences, and these are the consequences. Potential tooth loss, increased risk of heart attack, stroke, Alzheimer's, dementia, COVID-19 mortality, to list a few. The issue is maintenance. Once we do the gum treatment, which is necessary for these reasons, here's how it works. The maintenance is absolutely critical because the infection becomes most damaging. The periodontitis infection takes about 3 months to become damaging. So if we can disrupt the bacteria again at 3 months with the periodontal maintenance, rather than allowing it to sit for another 3 months, the 6-month interval, if we can disrupt it at 3 months and clean that bacteria out with the periodontal maintenance, rather than letting that bacteria progress again another 3 months, then the chances of having a relapse and a reinfection are dramatically reduced. So those are my thoughts today. It's a very common discussion that we have with the patients. I think for us providers, it's helping them understand this is your condition. Here are the consequences of your condition. Here are the risks associated with those conditions, with the consequences. Here are the benefits that your insurance provides based on negotiation between your insurance company and your employer, and not me. Here's what I can do to help you out. We got to get moving on this, and we got to get moving quickly. Some level of urgency is important because the sooner we can do treatment, the cheaper it is, the better off the patient is long term.